you're on a highway and you get in a car accident, please go to the hospital. If you're coming here with limbs all hanging off and blood all over, I can't do anything and you're going to die. So obviously, we want you to go to the hospital for things that the hospital's good at. But the hospital's not good at treating chronic disease. And they've even said themselves, allopathic medicine is going to me, it's going to exacerbate chronic disease 75% of the time, or more even. And those are the patients I get in here a lot of times. The ones that have been, a lot of times they've been on, not just MDs or allopathic, but they've been on a bunch of different practitioners and they've gotten some help. Some have gotten worse though, I have to admit. Some of them come straight from the guys that just use drugs and they're on like 8 different pharmaceuticals and they're getting worse and worse and worse. And I can get them off a lot of those drugs. And I work with a doctor. I try to work with their doctor, obviously, and talk to them, and I give them reasons why. Sometimes they will, sometimes they won't. But we try to get them off those drugs, and 9 times out of 10, they always get better when the drugs come out, and I put other natural things in there. But I also help them change their lifestyle. Now, I know why allopathic medicine gives the drugs a lot of times, because they say the patient's never going to change their lifestyle. There's just, a lot of people can't. So, and I do refer patients over to the allopath sometimes if I think that this is something really serious and they're not going to change their lifestyle. Well, I don't want them to have a heart problem or a heart attack or anything. So you guys can do it. You give them the statins, you lower their cholesterol and do all that. That's fine. And we do things a little bit differently. So not everybody can go through my system or wants to. That's okay. So I'm not here for everybody. I'm here for the patients that will come and resonate with me. And that's a lot. That's the majority. So you asked me the difference between allopathic medicine and like naturopath. Well, I look for the root cause. And the why I do that is because I love the lab companies I started getting into. Around the time I went to Belgium, I started saying, you know what? I like to do things backwards. I'm going to find out what the lab companies are going to measure, and they're going to find out how to figure out the pathology that way. Because they were bright, and the lab companies were usually the PhDs who invented the labs. So they had to know everything about the pathology to be able to find out what you want to elucidate to find out what's wrong with the person. And we're talking about hair, urine analysis, hair analysis for heavy metals or other things, urine for heavy metals, for thyroid, or not thyroid so much, but for hormones, other hormones besides the thyroid. Thyroid's blood. Then you have saliva, you have stool, you have genetics now, DNA. There's so many companies coming up with the genetics. I think that's still kind of in its infancy, and I've worked with some really good companies. But when I'm a physician and you're spending money with me, I don't want to just order something that's going to show me all your okay, here's a lab that shows me you have 87 different SNPs and these are all contributing. Well, how are they contributing to your health? It's you make it so complicated you can't treat it. So when I do labs, I'm doing a lab that I could treat. It has to give me some basis, some information that I know I can use it and treat with some medicine that's going to work. So we're looking more at the root cause, and that's what functional medicine does. Functional medicine uses really intense lab work. Like my blood panel that I have now from a special lab in New York City is going to be 30 to 40 pages long. The blood panel you go for your basic general checkup is 2 pages, 3 pages at the most usually. And they, maybe they're spaced closer together. I don't know. They do a lot on there, but we're looking at every single thing. There's genetics on there, there's vitamins, there's minerals, there's major inflammatory markers. Because I've learned over the years that the inflammation is the name of the game. Where you're inflamed is where you're going to have disease state. And now they have more and more markers look at inflammation, not just in the heart, in the coronary arteries, because that's where you want to find it the most, because that's what's going to heart attack, and that's the most prevalent disease. So you have to think, okay, what's my lab geared towards? Well, it's geared towards 50% of coronary artery disease, it's geared towards stroke, it's geared towards clots, it's geared towards cardiovascular and ischemia. So that's what we're having most. So I want to find those patients before they go down the line and they have an event, a heart attack or stroke, or they get on all these kind of drugs and then that's it, and they're going to have a bad time. So typically when they come in, when I look at these labs, I can see what's going to happen to them 3 months, 6 months, sometimes a couple years, maybe 5 years down the road. I can predict what's going to happen to them. And that's what I start to change right away. Some people just want to change, I'm having a chest pain or having an acute thing. I just want to get that to go away, and then I don't see them again. That's fine. Some people are kind of nervous and they see red on their lab. It's either green, yellow, or red. All the red's going down the side of the page, and that usually means they're pretty sick and they better do something, at least with the cardiac markers. They better change really fast. And I have the treatments, I have the more labs. I refer to a cardiologist, a wonderful friend of mine, and she's a cardiologist, she's a Harvard-trained UCLA staff, and she does things naturally too, a lot of things. So we collaborate a lot of times. If I think that patient's really sick, and she may need to go to the Allopathic, and that, right now for a little while, even the hospital, we need to get some testing on this. We need to do echocardiogram, we need to do serious testing, we need heartbeats. You can see the heart beating while they're on a bicycle. You know, that's the best thing when you're doing a stress test and you go echo stress. You can see every single thing. You can even look at the arteries, how they're beating and blood's going through or blood's getting stuck in them. So, but insurance is always going to determine if they're going to pay for that or not. So, so we have those guys doing functional medicine now, a lot. There's A4M, then there's IFM. There's many different schools that are doing really hardcore degrees. They're very difficult. And it's similar to what we did in naturopathic school. I think maybe even go a little bit farther. But then I haven't been in school in a long time, so I might have missed some things. But I try to keep up. I go to conferences, a lot of conferences every year. Yeah, so I mean the difference is they're treating symptoms and diagnosis, like this is the diagnosis, that's what it is. Well, a patient comes to me and says, I have Meniere's disease. I said, what does that mean? She says, I don't know, that's what they told me. Well, what are your symptoms? Well, I start spinning around the room in vertigo and I'm vomiting all over the place and I'm just horrible and she's going to be, her whole body is falling apart because she can't absorb any nutrients. And this has been like years and years, one of my patients. But I want to make sure she understands Meniere's is probably just somebody's name. And it's just a catalog of symptoms that they've associated with Meniere's. But what's the root cause of Meniere's? Now that's where we start looking at heavy metals, toxins, food allergies, environmental allergies, stress, number one killer, stress. Oh yeah, how you perceive your environment. That's why I had high blood pressure. Nobody knew what was wrong with me physically, right? But when I perceive things, I perceive like somebody knocking at the door would be a stressful event for me. And there's a lot of people out there like that, especially with the COVID. The phone rings. Should I answer it? I don't know. This is a stressful event because I have this like something's going to happen to me, kind of all these mental, emotional thinking. And that's where I'm talking about earlier that I want to work with patients to dissolve that. Because I can give them all the nutraceuticals, peptides, and everything in the world, and they will get better, but they're still going to, those thoughts are more powerful than all that medicine put together. And if they can't sleep and they still have all those thoughts going on, they're not going to heal, the growth hormone's not going to come out at night, they're not going to be able to do, they do the treatment, but they're not going to get better. So I always work with patients to see how far we can get with the physical, then we're going to go into deeper things if they want to do that with me.